Hi everyone, my name is Angela Landon and I am an independent insurance broker. I'm located in California, but I'm licensed in multiple states. And today what I'd like to do is review the Medicare Part D plan, D as in dog. This is your prescription drug coverage. Now, Part D is not something that you automatically get when you enroll in Medicare A and B. Part D is a separate coverage, and so I'd like to go over what that entails, and I'm happy to answer any questions for you as well. So, Part D, that is your prescription coverage. There's a couple of different ways that you can enroll in Part D. Number one is you can get it as a standalone plan, meaning that you can go to any insurance company and they have a separate Part D plan that you would have that insurance company only for your Part D. So you could do this if you have Medicare, original Medicare, and even if you have a supplement plan with that, you can get your Part D plan separately. The other way to get Part D is all inclusive with a Medicare Advantage plan. So with an Advantage plan, they are going to manage your A and your B and also Part D coverage. So those are the two different ways you can get it. You do have to have A and or B to have a Part D plan, and you have to be located in the insurance company's coverage area. So not all plans cover the same in every county. So keep that in mind. So one thing I'd like to go over is the late enrollment penalty. There is a potential penalty if you do not enroll in Medicare Part D within the time frame that you are allowed to enroll. So when you enroll in Medicare, you typically have once you turn 65, you have your 2 months before your birthday, the month of your birthday, and 2 months after your birthday to enroll. When it comes to Part D plans, you have 63 days from the time you become eligible to enroll in that plan. So typically when you're turning 65, you're within that window. This does come into play if you are working and you had creditable coverage when you were working. And when you stop working and you no longer have that coverage, you do have 8 months before you have to enroll in Medicare A and B. However, keep in mind, if you do not have creditable Part D coverage, you have 63 days to enroll in Part D, as in dog, without getting that penalty. Now, the penalty is 1% per month that you did not enroll in the plan when you should have, and it's 1% times the national base premium of the year. So for 2025, the national base premium is $36.78. So if you delayed enrolling in Part D for 12 months, you would have a 12% penalty times 36.78, and that would be added for the remainder of your lifetime. There have been some changes to Part D. So some changes have been put into place ever since 2023. So back in 2022, there was a law passed called the Inflation Reduction Act. And the purpose of that law was really to increase access to treatment for people on Medicare. It also one of the goals was to make Medicare more sustainable so that it would be around for the long term. And then also just lower the cost of Medicare in general. And so as part of that law and that plan over these past few years and also coming up, there have been and will be changes to Medicare. For 2023, what they did was stop any copays for vaccines, and also they limited the cost of insulin to $35 per month. So you cannot pay more than $35 a month for insulin starting 2023. So that still is taking place today. In 2024, they expanded the eligibility for people to get extra help. So extra help is a program that provides assistance for medications. And I'll go a little bit more into that in a little bit later. And then the other thing that they did in 2024 was they eliminated the 5% uh, co-insurance for the catastrophic phase of Part D. So prior to 2025, Medicare Part D had 4 phases. It was your deductible phase, your initial coverage phase, then there was a coverage gap, and then the fourth stage is catastrophic phase. So that 5% was eliminated. Once you make it to catastrophic phase, you don't pay anything for your medications going forward. For 2025, huge changes. So in 2025, they have lowered the cap of your prescription medication to $2,000. So prior it was $8,000. Now it's $2,000. That's a huge change. Also, they added something called a monthly payment prescription plan to help you spread the cost of expensive medications over the entire year so that you don't have to pay a whole lot upfront out of pocket. They have also redesigned Part D. So I talked about those four different phases of Part D. They've eliminated the coverage gap. So for 2025 and going forward, there's 3 phases. You have your deductible phase, you have your initial coverage phase. So once your deductible is met, if there is one, then you pay your copay or your co-insurance, depending on the formulary where your medication falls. And then once your medication cost reaches $2,000, then you no longer have to pay for your medications for the remainder of the year. And in 2025, they also implemented a manufacturer discount program. So this helps to bring the cost of the medications down. It's not something that you're really going to see as far as a coupon or anything, but it's something that you should see in way of having less expensive medications. Although I will say they still are kind of expensive. When it comes to these changes for 2025 and your Part D plan, as I stated, your maximum out of pocket is capped at $2,000, which is great. Also, your monthly payment plan allows you to reduce the stress of financial insecurity so that you can spread that cost over time. And then you should gain access then to brand name medications that may have been too costly for you to pay out of pocket in the past. When it comes to the Medicare payment prescription plan, one thing to keep in mind, it's more beneficial to start it sooner in the year than later because then you have more months to spread out the cost. Some drugs that are excluded from the Medicare prescription payment plan. So if your medication is not covered by your insurance company, it is not covered in your formulary at all. It's not going to be able to be covered in the prescription payment plan. This has to be something that the insurance company is covering some portion of, even if it's 50%, whatever it is. They have to cover something for your cost to be spread out over a period of time. And then it does not cover Part B, B as in boy. So Part B medications are typically those that are infused by a doctor's office or a hospital setting. It could be an infusion or an injection, but it's something that has to be administered at a doctor's office or hospital setting. Those are not covered under the payment prescription plan. That would be under your Part B insurance. Once you have opted into the payment prescription plan, it's going to apply to all of your medications. So it doesn't just apply to the expensive medications, or you can't just pick and choose. It's going to be all medications that you are prescribed will fall into the payment prescription plan. What you would do is go to your pharmacist, say that you want to enroll in this plan. You should be able to take your medications with you without cost on that month, and then you're going to start receiving a bill. So you'll get a bill every month to pay for those medications. And so it'll be split out for the remainder of the year, whatever's left in the year. Things to keep in mind because of these changes. Insurance plans have also had to make big changes. So some of these could be, some Part D plans may choose not to cover certain medications. We certainly have seen that for 2025, where insurance plans have taken some medications off of their formulary. And I anticipate we might see a little bit in 2026, a little shakeup as well. The insurance plan's liability is increasing in the catastrophic phase because your cap is now $2,000. So that puts more of the financial burden on the insurance company. So you may see an increase in cost while you see, even though your medications are going to be lower, you may see a rise in costs in other areas. And you may also see a reduction in plan services. So I do expect going forward, we may see a little bit more of that. And as soon as I have information about 2026, I will share that with you. But I think in 2025, this is when the insurance companies are really, they are feeling firsthand what it meant for them to have to take on more of the burden of the medication costs. And so they're going to try to figure out how they can reduce their costs in other ways. Things to be aware of. So in September, you should receive an annual notice of change. Oftentimes people just toss those in the garbage, but I would say please keep an eye out for it and make sure you review it, because this is going to tell you how your plan is going to change for 2026. And it's very important. Or whatever year you're looking at this, you will get it around September and look at it for the following year so that you know how your plan is going to change. The other thing I'll say, this is a great reason to have a broker. So have a broker on your side. One of the responsibilities of a good broker is to reach out to you on an annual basis and let you know about any changes to your coverage, and also help go through your medications so that we can determine if they are all still going to be covered the following year, or do we need to find you another plan where all your medications are covered. So that's a reason to reach out to a broker, or you can reach out to myself if you have any questions. I would also say keep a list of your medications. Keep it updated. I know sometimes you may get taken off of a medication and you may add a medication. And so make sure you have an accurate list of medications. So when you go through an annual review, it's a lot easier to just see what currently you are taking and make sure that we have the accurate information for you. So I will go through that Extra Help program just a little bit. So Extra Help is a program to help pay for the cost of prescription drugs. Now, this program is not Medicaid. It's not Medi-Cal. It's not Medicaid. So if you didn't qualify for Medicaid, that doesn't mean you don't necessarily qualify for Extra Help. They don't take your assets into consideration. What they do take into account how much money you have in the bank. But if you happen to be in a situation where your medication costs are getting too out of hand, consider this program. You can enroll on ssa.gov. There's a drop down. You still go to ssa.gov and you do the Medicare drop down, and then there's Part D plans and Extra Help. And so that would help potentially if you have a number of medications and they're costly. The cap for Extra Help is $11, depending on where you qualify. So if you qualify fully, you may not have to pay anything for your medications, or you may have to pay a little bit out of pocket, but it could be a help if that's something that you need. So keep in mind that that's a resource for you. And so that's all I have about Medicare Part D. So if there's any question that you have, you're welcome to reach out to me. I have a QR code here. If you'd like to make an individual appointment with myself, you can do so. Also, if there's a certain topic you'd like me to discuss, or if you have questions about, I'm happy to make a video about it. So leave that in the comments. And if you like this content and you want to see more of it, please do like and subscribe on my channel. And I'll see you in the next video.